My name is Mackenzie Mulkey. I'm going to be doing a pediatric medication administration today, and during this whole procedure, we're going to be following our general principles and safety practices. The first thing I'm going to show is your IV and your IM sites. And your IV sites, you're going to have your frontal, your temporal, your auricle. You're going to have your basilic, cephalic, and on the inside of your arm, you're going to have your median cubital and your median. And then we're going to have down the leg the great saphenous, and then into the median marginal. And then for your IM injections, we're going to have the deltoid, which is 1 to 2 finger breadths below the acromion process. And then for the vastus lateralis, we're going to look for your greater trochanter and your patella, and it'll be the inner third. It'll be about right there. And then for the ventral gluteal, we're going to stick our hand on the greater trochanter, and our thumb will be towards the groin, and then we were going to have our index finger towards the ischial spine, and then our middle finger towards the ischial crest. And then we'll give that right in between the V. And then we are going to go ahead and get our medications together. So we are going to do our 3 checks, and that includes our first check is you're going to be at the Pyxis, and you're going to be pulling out the medications from the drawer, and you're going to be comparing it to the orders. And then the second check is the expiration date, the allergies, and if they have any calculations for the medications, we'll do that. Then we're also going to do our 6 rights. So we have patient, time, route, dose, documentation, and medication. And so that's our 6 rights. And then with our third check, we'll be at the bedside. And so whenever we go in for to give the medication, we're going to look at the infants and the guardian's relationship. We're going to look at them, and then we're also going to make sure that we have a good relationship with them. And because we want this baby to like us during this whole procedure. And so with the third check, we're going to do our 6 rights again, and then we're going to make sure that this patient is who we want, which is included in our 6 rights. And with our oral medication, we're going to do a few different things. We're going to do the oral administration, the vastus lateralis restraint, and the eardrops. But with the oral, we're just going to have them sitting on our lap, and we're going to wrap our arms around them. We're going to pull up any medication that's needed and give it on the inside of the cheek. And we may have to stroke their chin or underneath their jaw to help them swallow it. And then with the eardrops, we are just going to have them laid down, and we're going to turn their head to the side. We're going to pull the pinna down and back, and we're going to put the eardrops just inside the ear, and we're going to let them go down themselves. And then with the vastus lateralis shot, we are going to put their arms up. We're going to put our arm over their abdomen, and then we're going to make sure that one of their legs is straight, and we're just going to give it in the vastus lateralis position there. And with this, we are going to teach the parent or the guardian about any adverse effects, or what the medication's for, and what they should look for. Will the baby possibly have a low-grade fever afterwards? We just want them to be on the lookout for things like that. And we will wrap the infant, give it back to its mother, and ask them if they have any questions, and we will document. Thank you.